If you think that ADPIE, assessment, diagnosis, planning, implementation, and evaluation, is simply a checklist, and if you think that nursing diagnoses are simply a thing of the past, you're actually not totally wrong. But you're definitely not ready for what's coming next either. Because the truth is, the nursing process is not dead, but it's very, very misunderstood. And if you're a new nursing student still studying with the same memorization study strategies that you used for anatomy and physiology, you're going to hit a wall when these nursing school questions start getting harder, and they will get harder. In this video, I'm walking you through 5 NCLEX style practice questions, one for each step of the ADPIE nursing process. These will challenge what you think you know about ADPIE and show you how to start studying like a nurse instead of just cramming like a student. Let's get started.
Question number 1. You might not be surprised to know that this is the assessment question, which is the first step in the ADPIE nursing process. But don't expect them to tell you which step of the nursing process they're testing you on in nursing school when you're on your actual exam. Question number 1. Which of the following are the 3 types of nursing assessments? A, initial, focused, and emergency. B, subjective, objective, and comprehensive. C, physical, psychological, and social. Or D, primary, secondary, and tertiary. Pause if you want to try answering the question before I show you the answer. The answer is A, initial, focused, and emergency. Let's make sure you understand why this is the answer so you can answer it for yourself on your nursing exams. This is an example of a question that's at a lower difficulty level on Bloom's taxonomy, but it's more common in the early days of your first semester of nursing school. That's because this is information you could have just read the chapter and memorized. That's really what makes it a lower level question. When you get to the higher levels of Bloom's taxonomy, that would be the analyze, apply, and even evaluate levels of difficulty, then you quickly find that memorization doesn't work anymore because they're testing you on how to think. But sometimes memorization does work. You just have to make sure that you are memorizing the right sorts of things. How do you know if this is something you should memorize while you're studying? In a situation like this, I'd recommend looking at the learning objectives in your textbook chapter. And you can learn more about that study method by watching my critical thinking video, which I will link to at the end of this. But if you did study that way, then you would clearly note that initial, focused, and emergency are the 3 types of nursing assessments. They do a good job of trying to trick you by throwing in other vocabulary you're familiar with. For example, subjective and objective are types of assessment data we can collect, but they are not types of nursing assessments. Physical, psychological, and social sounds kind of impressive, and we will assess these areas when we do an assessment, but it's still not a type of nursing assessment. And primary, secondary, and tertiary, we're getting into some jargon, some vocabulary that has to do with types of interventions we might do. But at the end of the day, this question, you're probably either going to know it or you don't. So you want to make sure you're studying in a way that you feel confident you are memorizing the correct things and not overloading your brain by memorizing a lot of things you don't need to memorize. Question 2. The nurse is caring for a client who has been diagnosed with pneumonia. Which of the following would be a priority nursing diagnosis? A, impaired gas exchange. B, pneumonia. C, acute respiratory failure. And D, ineffective airway clearance. Pause if you'd like to try answering this before I give you the answer. The answer is A, impaired gas exchange. Let's talk this through so you can answer this question correctly on your nursing exam. First off, you are not going to get a question about nursing diagnoses on NCLEX. I seriously doubt you'll see them on HESI or ATI either for the same reason. And that's because NCLEX no longer uses nursing diagnoses. They've kind of fallen out of favor in recent years. However, a lot of nursing schools do still use nursing diagnoses for care plans and teaching purposes, and therefore you may see the occasional question about nursing diagnoses on your nursing classroom exams. I know a lot of people hate nursing diagnoses, but I stand by. They can be a very good teaching tool when used well. In the case of this question, we need to know a little bit about pneumonia. As long as you know it's a respiratory illness, that's almost enough. If you know the specifics of pneumonia, that the pathophysiology is inflammation of the lungs, then that's going to make this question even easier to think through like a nurse. Unlike question number 1, this question is a higher level question that requires you to analyze and apply information that you know in order to think like a nurse. It's also helpful if you've begun to get familiar with some of the nursing diagnoses. B and C we can throw out immediately because these are medical diagnoses. That's outside of the scope of our practice. That leaves us A and D to decide between. D happens when the bronchi are kind of being blocked, so that the airway is not able to be cleared. Now, this can happen in pneumonia. However, it's not the priority because what happens before that is the impaired gas exchange. That is the priority because we can have mucus accumulating in the alveoli, which prevents the oxygen and carbon dioxide from switching places, which means the blood will not be oxygenated. And this is the problem that is most closely tied to pneumonia and the inflammation that's happening around the alveoli and everywhere in the lungs. Therefore, A is the best answer. Question 3. A nurse is developing a care plan for a client who has been diagnosed with hypertension. Which of the following goals statements best reflects the use of the SMART model? A. The client will understand the importance of taking medications regularly. B. The client will demonstrate correct use of a blood pressure cuff within 3 days. C. The client will feel better about managing their hypertension. Or D. The client will attend a follow-up appointment with their healthcare provider. Pause if you'd like to try answering before I give you the answer. The correct answer is B. The client will demonstrate correct use of a blood pressure cuff within 3 days. Let's talk this through so you can answer it correctly on your exam. In order to answer this question correctly, you have to know what the SMART model is. The SMART model uses the acronym SMART to help you set good goals. This is what SMART stands for. The goal has to be specific. It has to be measurable. It has to be achievable. It has to be relevant to the client's care, and it has to be time-bound. Let's check answer B and make sure it meets all 5 of those criteria. First off, it is specific because it's talking about the correct use of a blood pressure cuff. It's measurable. We can watch the client and we can decide if they have correctly used the blood pressure cuff. It's achievable. Within 3 days, somebody should be able to learn this skill. It's relevant to the client's care. They have been diagnosed with hypertension, and being able to monitor their blood pressure is very relevant. And it is time-bound. We have 3 days to achieve this goal. If more than 3 days has passed and they have not achieved this goal, we know we have not met the goal. Therefore, B is the correct answer. Question number 4. A nurse is preparing to implement a discharge teaching plan for a client with newly diagnosed diabetes mellitus. Which of the following actions by the nurse best demonstrates the integration of cognitive, interpersonal, and psychomotor skills? This is an example of the 4th step of the nursing process, implementation. Here's our answer options. A. Explaining the importance of blood glucose monitoring and demonstrating the technique to the client while engaging in a supportive conversation. B. Reviewing the client's medication list and discussing potential side effects in a group education session. C. Encouraging the client to attend a diabetes support group and offering to arrange transportation. Or D. Documenting the client's understanding of dietary changes in the medical record after a comprehensive teaching session. Pause the video if you'd like to think it through and answer for yourself before I give you the answer. And the answer is A. Explaining the importance of blood glucose monitoring and demonstrating the technique to the client while engaging in a supportive conversation. Let's talk this through so you can get questions like this correct on your nursing exam. In order to answer this question, some of the normal stuff you have to have memorized from your book are what does it mean to address the cognitive, interpersonal, and psychomotor skill set when you're dealing with clients. And what it is we need to be addressing their brain, their logical thought processes. We need to be addressing the relationship and the emotions. And especially if it's a hands-on skill, we want to see that they can demonstrate the hands-on skill part of it. Option A is the only one that demonstrates all 3 of that. So let me show you how it does. When we explain the importance of blood glucose monitoring, that is the cognitive aspect. When we are demonstrating the technique to the client for how to measure blood glucose, that is the psychomotor skill. And when we are engaging in a supportive conversation, we are addressing the interpersonal side of things. And that is why A is the correct answer. Question number 5 is a question about the evaluation step of ADPIE. The nurse is evaluating a client's response to a plan of care. Which of the following actions should the nurse take to effectively evaluate the client's care? A. Compare the client's current health status to the expected outcomes. B. Review the client's chart to find initial assessment data. C. Reassess the client's baseline vital signs. Or D. Document the client's subjective complaints. Pause if you'd like to think it through and answer for yourself before I give you the answer. The correct answer is A. Compare the client's current health status to the expected outcomes. Let's talk about why this is so you can answer questions like this correctly on your exam. In order to answer this question correctly, we have to know what the evaluation step of the nursing process involves, and you have to have studied that. If you have, you would remember that the evaluation step is about looking back at the process we have gone through with this client so that we can decide if their plan of care has been effective or if we need to make changes so that we can help them to continue to improve. A is another way of saying that. We're comparing the client's current health status, which is after the care has been received, and we're comparing that to the expected outcomes. These are the outcomes we would have identified in the planning step of the nursing process. If we have met those SMART goals, then we know that our plan of care was a success. If we have not, we know we need to make changes and adapt. We might review the client's chart so we can compare their initial assessment data to their current assessment data, but that's only one piece of the evaluation process, whereas A talks about the whole thing. C is another piece of the process. We might want to know what the current vital signs are so that we can help evaluate if it meets the expected outcomes. But this is a more complete explanation. And D, document the client's subjective complaints. This is really something more we would do in the assessment stage of the nursing process, which means the correct answer is A, compare the client's current health status to the expected outcomes. If you were surprised by how tricky some of these questions felt, or if you feel overwhelmed by the amount of information you feel like you have to memorize to get these correct, that's exactly why most students get stuck in fundamentals, because it's important not to focus on memorizing endless facts. Instead, you need to study in a strategic way that builds real understanding so you can think like a nurse. And you need to do it before you sit down to take the test. If you want to learn a better way of studying, I have two options for you next. First, you can learn how to use the learning objectives at the beginning of each chapter to efficiently study without reading your textbook word for word. That's this video over here. Or if you're ready to learn the entire Silver Bullet study system, the absolute best way to study in nursing school, head on over here. Either way, I'll see you in the next video.